Last week, I dropped by to visit Sandra, one of my favorite neighbors and a dear friend of our family. Sandra is 75 years old, lives alone in a cozy little house just outside Columbus, Ohio, and she's the type of woman who makes the best lemon cookies in the entire county. Every afternoon, she takes a slow walk around her garden, checks on her lavender, and gives the rose bushes a little pep talk. But that day, something was different. As she greeted me at the door, she was barefoot, her sandals sitting off to the side. She smiled, but I could tell something was bothering her. "These shoes just don't fit by the end of the day anymore," she said, lifting one leg onto a footstool. "My feet and ankles get so swollen every afternoon, even though I haven't gained a pound." Now, if you're in your 60s, 70s, or beyond, I'm guessing you've had days like Sandra's. You wake up feeling okay, but by the late afternoon or early evening, your legs feel tight, your socks leave marks, your shoes feel snug. Maybe your ankles puff up and you wonder, is this just old age, or is something wrong? I get it. Swollen feet and ankles can be frustrating, and even a little scary. They can make it hard to walk, cause your shoes not to fit, and sometimes come with pain, numbness, or a heavy feeling in the legs. But here's the good news. In most cases, there are answers. There are simple, safe ways to manage swelling, and even prevent it. Today, I want to walk you through 6 common causes of leg and ankle swelling, especially in older adults, and share 5 easy fixes that don't require fancy equipment or complicated routines. These are practical tips you can try at home, starting today. And along the way, I'll share stories from real people in our age group, folks like Sandra, Walter, and Fred, who faced the same issues and found relief. Because sometimes, it helps to know you're not the only one going through it. Before we dive in, let me ask, have you ever felt your feet or ankles get swollen by the end of the day, especially if you've been sitting or standing for long hours? If so, let me know by typing the number 1 in the comments. That helps me, and helps YouTube. Know that you're part of this conversation, and it brings this video to more people who need it. Now, let's start by understanding why this happens. What's going on in our bodies that causes swelling? And how can we tell when it's something serious, and when it's just our body's way of saying, hey, I need a little support here? Let's start by clearing something up right away. Swelling is not always a sign of something dangerous, but it is your body's way of telling you something isn't working quite right. Whether it's poor circulation, fluid retention, or just tired muscles, swelling is a signal worth paying attention to. What happens is this. Gravity pulls fluid down into your legs and feet. If your veins, muscles, or lymph system aren't pumping that fluid back up efficiently, it starts to pool. That's when you see puffiness in your ankles, tightness in your shoes, or that familiar heavy leg feeling that makes you want to kick your feet up. Now, in Sandra's case, it wasn't a medical emergency, but it was affecting her quality of life. She started skipping her garden walks. She didn't want to wear certain shoes. And worst of all, she began to assume it was just normal for her age. But it's not. Just because something is common doesn't mean it's normal, or that you have to accept it. When we're younger, our body is better at keeping fluid in balance. But as we age, our circulation slows down. We sit more. We move less. Our muscles aren't as strong, and the valves in our veins may not work as well as they used to. Add in some medications, health conditions, or even changes in the weather, and it's no surprise that our legs start to swell more often. But here's the thing. You have more control than you think. In this video, we're going to talk about the 6 most common reasons for leg and ankle swelling in people over 60, or which ones are serious and need a doctor's attention, and the 5 easiest things you can do today to feel better fast. And I promise you this, none of these tips involve fancy equipment or painful treatments. We're keeping it simple, gentle, and doable. Now, before we move on to part 2, where we'll explore the top 6 causes, take a moment to think. What time of day do you notice swelling in your legs the most? Morning, afternoon, or night? Type your answer in the comments. And if you've never really paid attention before, make today the day you start. That small habit of awareness could make all the difference. All right, let's move forward. In the next section, we'll go over each cause, one by one, with real examples, plain language, and signs to watch for, so you'll know exactly what your body might be telling you and what you can do about it. Stick with me. You're going to learn something today that your legs will thank you for. Swelling, or what doctors call edema, isn't a one-size-fits-all problem. There are several different reasons your legs or ankles might swell. Some serious, some simple, and often, more than one cause can be happening at the same time. In this section, we'll cover 6 common causes of swelling in older adults. I'll break them down in plain language, and where needed, I'll let you know when it's time to talk to your doctor. Let's start with the most common one, because this might be what's happening to you right now. Cause number 1. Poor circulation from sitting or standing too long. Let's say you're reading on the couch, or maybe you're in the kitchen standing for a while. By the time you sit down to rest, your legs feel tight, maybe even warm or achy. Sound familiar? As we get older, the veins in our legs have a harder time pushing blood back up toward the heart. This is especially true if we're sitting or standing still for long periods. The muscles in your calves usually act like pumps, helping your veins do their job. But if those muscles aren't moving, blood and fluid settle in the lower legs, and swelling sets in. Walter, one of my neighbors, is 78 and loves to play dominoes. But after a 3-hour game session, he told me his ankles looked like little balloons. The problem wasn't the dominoes, it was the sitting. He just needed to get up every hour, move around, or do simple foot pump exercises to keep things flowing. So here's your first check-in. Do you spend long hours sitting without moving your legs? If so, drop a number 1 in the comments. I've got a great trick coming up later that can help without even leaving your chair. Cause number 2. Chronic venous insufficiency or varicose veins. This one sounds technical, but it's simple at heart. Your veins have little one-way valves that keep blood moving up against gravity. But over time, especially as we age, those valves can weaken. When that happens, blood leaks backward and pools in the lower legs, leading to swelling, discomfort, and even skin changes. You might notice visible blue or twisted veins, or feel an aching, heavy sensation by the end of the day. It's not just cosmetic. Chronic venous insufficiency can lead to long-term leg issues if not addressed. Thankfully, compression socks, leg elevation, and walking more can all help. Sandra had been dealing with this for years without knowing it. She thought it was just bad circulation. But after a checkup confirmed it was venous insufficiency, she started wearing gentle compression socks during the day and propping her legs up in the evening. Within a week, she was walking more comfortably, and her shoes actually fit again. Cause number 3. Serious medical conditions, heart, kidney, liver issues. Now, this one is important. Sometimes, swelling is a sign of something deeper going on inside your body, particularly with your heart, kidneys, or liver. If the heart isn't pumping efficiently, fluid builds up in the legs, common in congestive heart failure. If the kidneys aren't filtering properly, fluid stays in the body, as in chronic kidney disease. If the liver is damaged, proteins that regulate fluid balance drop, seen in liver disease. These types of swelling are usually symmetrical, both legs, may be more noticeable in the evening, and often come with other symptoms like shortness of breath, fatigue, or weight changes. If you notice swelling that comes on suddenly, doesn't go away, or is accompanied by other symptoms, don't wait. Talk to your doctor. It might not be serious, but it's better to be safe than sorry. Part 2. 6 common causes of leg and ankle swelling in older adults. Part 2 of 2. We've already looked at 3 of the most common reasons your legs and ankles might swell: poor circulation, weakened veins, and underlying health conditions. Now let's look at 3 more causes that are often overlooked, but just as important to understand. Cause number 4. Lymphedema. When the lymph system doesn't drain properly. Your body has something called the lymphatic system, a network of tiny vessels that help drain excess fluid and waste from your tissues. Think of it as your internal cleanup crew. When that system gets damaged or blocked, it can't do its job. The result? Fluid builds up under the skin, especially in the feet, ankles, and lower legs. This condition is called lymphedema, and it often causes swelling that feels firm, tight, or even rubbery. People with lymphedema may notice their skin becoming thicker or rougher, and in some cases, It can lead to infections if not managed properly. Lymphedema can be caused by past infections, injuries, surgery, or even long-term obesity. One of my longtime friends, Irene, 74, developed it after a skin infection in her foot years ago. She used to wear thick socks all day, thinking it would help. But what really made the difference was getting proper manual lymph drainage massage and wearing a prescribed compression sleeve from her podiatrist. If your swelling feels different, firmer than usual or only on one side, and hasn't responded to elevation or movement, it's worth getting evaluated. Cause number 5, medication side effects. Did you know that many common medications can cause swelling in the legs and feet? Drugs used to treat high blood pressure, diabetes, inflammation, or even hormone therapy can all affect fluid retention. Calcium channel blockers, NSAIDs like ibuprofen, certain steroids, and even over-the-counter supplements can trigger swelling as a side effect. It doesn't mean you need to stop taking your medication, but if you've recently started a new one and notice increased swelling, don't ignore it. Have a quick chat with your doctor or pharmacist. Sometimes switching to a different drug or adjusting the dose is all it takes. Don't be afraid to ask. Your comfort matters. Cause number 6, footwear and alignment issues. Now here's one that surprises a lot of people. Your shoes, or the way your body is aligned, might be causing your swelling. If your shoes are too tight, too flat, or lack support, they can restrict circulation and place uneven pressure on your feet and ankles. Over time, this leads to swelling, especially if one leg is slightly longer or stronger than the other, which is more common than you think. Martha, 72, went through 3 pairs of sandals last summer, thinking her feet were just getting wider. Turns out, one of her knees was slightly stiffer, throwing off her balance and forcing one side to overcompensate. With a visit to her podiatrist and a pair of custom orthotic inserts, her swelling improved within a week, and her shoes finally fit again. So if your swelling is mostly on one side, or seems to be tied to certain shoes, it might not be your age. It might just be your alignment. Alright, now that we've covered the 6 most common causes, let's move on to the part you've probably been waiting for. What can you do about it? In the next section, we'll explore 5 easy fixes that you can try at home to reduce swelling, improve comfort, and support healthier legs every day. Trust me, these tips aren't just practical, they actually work. Now that we've explored the most common causes of swelling in your legs and ankles, you might be wondering, okay, what can I actually do about it? That's what this section is all about. Simple, practical solutions that you can start using today. These are the things I've recommended to friends, neighbors, and even my own relatives. And the best part? They're gentle, they're natural, and they really work. Let's jump right in. Fix number 1. Elevate your legs every day. This one might sound simple, and it is, but it's also incredibly powerful. When you elevate your legs, you're helping gravity do the work that your veins and lymph system sometimes struggle with. By raising your feet above heart level, even for just 15 to 20 minutes, you encourage fluid to drain back toward your upper body, relieving that heavy, swollen feeling in your lower legs. Fred, a retired teacher I know, started this habit after dinner each evening. He props his legs up on 3 pillows while watching the news, and within a week, he said his socks stopped leaving marks and his feet felt lighter in the morning. Here's a tip. Do it twice a day, once in the afternoon and once before bed. Support your legs fully from heel to thigh. Keep your back comfortable too. Don't twist or strain yourself trying to get the angle right. Try it for a week and let me know what happens. If you've already done this before, type the number 1 in the comments. Let's see how many of us are already elevating. Fix number 2. Stay hydrated and watch your salt. This might sound backward, but it's true. Not drinking enough water can make swelling worse. When your body senses dehydration, it tries to hang on to every drop of fluid it has, often storing it in your tissues, including your legs and ankles. Combine that with too much sodium, which pulls water into your bloodstream, and you've got a recipe for swelling. So what can you do? Drink plenty of water throughout the day, especially if you take medications that affect fluid balance. Limit salty snacks and processed foods. Think canned soups, frozen meals, or chips. Try flavoring your water with a slice of lemon or cucumber to make it more enjoyable. One woman in our walking group, Judith, said she didn't realize how much sodium was hiding in her healthy frozen dinners. After swapping those for simple home-cooked meals and drinking an extra glass of water a day, her ankle swelling dropped by half in just 2 weeks. This one small shift can have a big impact, especially when combined with the other tips coming up next. So far, we've talked about elevating your legs and staying hydrated while limiting salt. 2 simple strategies that can make a huge difference. Now let's explore 3 more easy fixes that complete the picture. These aren't just tips. They're habits that can gently change the way your legs feel each day. Underscore 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 underscore. Fix number 3. Gentle leg movement, even from a chair. You don't need a gym. You don't need fancy equipment. Sometimes, all your legs need is a bit of gentle, regular movement, especially if you spend a lot of time sitting. The trick is to mimic the natural pumping action of your calf muscles, which help push blood and fluid back toward your heart. When we're inactive, that pump shuts down, but even small movements can wake it up again. Try this. Sit up straight in your chair. Keep your heels on the floor and lift your toes up and down 10 to 15 times. Then reverse. Lift your heels while your toes stay down. Do this every hour or so, especially if you're watching TV, reading, or using the computer. These simple motions stimulate circulation without stress or strain. Walter, our domino champ, started doing this during breaks in his games, and after a few days, he said, "My ankles don't feel like sandbags anymore." It may look silly, but it works. Try it now while you're watching. And if you feel a little stretch or tingle in your calves, that's a good sign. Underscore 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 underscore. Fix number 4. Try compression socks, the right kind. Compression socks aren't just for travelers or athletes. They're one of the best tools for managing swelling in everyday life, especially for seniors. The gentle pressure helps keep blood and lymph moving, preventing fluid from pooling in the legs. But here's the key. Not all compression socks are the same. You want light to moderate compression. Around 15 to 20 millimeters of mercury is a good start. Knee-high style unless recommended otherwise. A breathable, moisture-wicking material, especially if you wear them for long hours. Sandra was hesitant at first. "Won't they be tight and uncomfortable?" she asked. But once she found a soft pair made specifically for seniors, she started wearing them in the morning. And by evening, her sandals still fit comfortably. Start slow. Wear them for a few hours at first, and build up as your legs adjust. If you already use compression socks, type number 2 in the comments and share your experience. We'd love to hear what works for you. Underscore 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 underscore. Fix number 5. Use supportive shoes and custom insoles if needed. We often forget just how much our feet affect our legs. Poorly fitting shoes, flat soles, or lack of arch support can throw your whole alignment off, causing one side to carry more weight than the other and leading to swelling, especially in just one ankle or foot. Supportive shoes should have a cushioned heel, firm sole, and slight arch. Should not press or squeeze your foot, but should feel stable, not wobbly or soft. In some cases, a custom insole or heel lift can correct imbalances caused by arthritis, knee issues, or even having one leg slightly longer than the other. Martha didn't realize that her favorite sneakers were contributing to her swelling until she swapped them for a new pair with the proper arch and firm heel support. "I thought it was my age," she said. "Turns out it was just my shoes." Underscore 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 underscore. With these 5 fixes: leg elevation, hydration, gentle movement, compression socks, and supportive footwear, you now have a full toolbox for reducing swelling naturally and safely. In the next part, we'll talk about when swelling might be a red flag and when to see a doctor. Because while many cases can be managed at home, there are moments when getting checked out is the best thing you can do for your health. Stick around. This next part is just as important. Now, we've talked a lot about what you can do at home to reduce swelling. And for many people, those fixes really do the trick. But it's just as important to know when swelling is a signal that you need to see a doctor. Swelling by itself isn't always dangerous, but in some cases, it can be the body's way of waving a red flag, telling you that something deeper might be going on. Let's go over a few signs that it's time to talk to your doctor, or even seek help sooner rather than later. Sign number 1, swelling that's only in one leg. If only one leg, ankle, or foot is swollen, and especially if it's new, sudden, or painful, that's something to get checked out. This could be a sign of deep vein thrombosis, DVT, a blood clot that forms in a deep vein, often in the calf or thigh, infection or cellulitis, which can cause redness, warmth, tenderness, or fever, or an injury like a sprain or torn ligament that's affecting blood flow. Irene, who I mentioned earlier, once thought her one-sided swelling was from walking too much, but after noticing her leg was also warm and a bit red, she went to urgent care, just in time to catch an early infection. Moral of the story? If swelling is one-sided, warm, or comes on quickly, don't wait. Let your doctor take a look. Sign number 2, swelling with shortness of breath or chest pain. If your legs or ankles are swelling and you're experiencing a shortness of breath, especially when lying down, chest discomfort, or sudden weight gain or fatigue, it could be related to your heart, especially congestive heart failure. This type of swelling often gets worse at the end of the day, or after a salty meal. You might also notice it in your abdomen or hands, not just your legs. Sandra once told me she was just feeling extra tired, and that her shoes barely fit by dinner time. After checking with her doctor, they discovered she needed a slight medication adjustment to help manage her blood pressure and heart rhythm. She was grateful she didn't brush it off, and so was I. So if swelling is paired with breathing issues or chest tightness, that's not a wait-and-see situation. It's time to call your doctor. Sign number 3, swelling that doesn't improve with rest or home care. If you've elevated your legs, stayed hydrated, watched your salt, tried compression or gentle movement, and after a week or 2, your swelling hasn't changed, that's a sign to dig a little deeper. Sometimes the underlying issue isn't visible from the outside. It could be related to your kidneys, liver, or vein function. A doctor can run a few basic tests to get you answers and point you in the right direction. Let's be honest, getting older comes with plenty of surprises. Some are beautiful, like grandkids and extra time for hobbies. But others, like leg swelling, can feel frustrating, confusing, and sometimes a little scary. But here's something I want you to remember. You're not alone, and you're not powerless. You don't have to accept swollen feet or heavy legs as just part of aging. There's almost always something you can do, some small, manageable step that can help your legs feel lighter, stronger, and more comfortable. You've already taken a big step just by watching this video. That means you're paying attention to your body. You're listening, and that matters. Fred once told me, I thought I'd just have to live with my legs feeling like tree trunks. But after making just 3 small changes, propping his feet up, drinking more water, and switching shoes, he called me a week later and said, I feel 10 years younger. I didn't think something so simple could make such a difference. And I bet it can for you too. Let me leave you with a few quick reminders. If your swelling is new, one-sided, or comes with pain or warmth, get it checked. If it's paired with chest discomfort or shortness of breath, call your doctor immediately. And if it's just the everyday kind of swelling many older adults deal with, start with the 5 easy fixes we talked about. Don't try to do everything at once. Pick one small thing. Maybe it's elevating your legs this evening, or drinking 1 extra glass of water tomorrow, and build from there. And now, I want to hear from you. What fix from today's video are you most excited to try first? Type the number 1 if you'll try leg elevation. Type 2 if you're ready to get moving, even from your chair. Or type 3 if supportive shoes are on your to-do list this week. Your comment might just inspire someone else watching this video to take their first step too. And if this video helped you, I'd be honored if you'd hit the like button, share it with a friend, or subscribe to this channel. Every time you do, it helps YouTube recommend this content to other people who need support, just like you. Because that's what vitagohealth is all about. We're not just talking about health. We're walking through it together, step by steady step. Until next time, take care of your legs. They've carried you far. And with a little attention and kindness, they'll keep carrying you with strength and comfort in the years ahead.